Hi, I'm Chris with the New Mexico Aging and Long-Term Services Department, State Health Insurance Assistance Program, or SHIP. And this is going to be a quick tutorial video to help you learn to use the Medicare Plan Finder to do plan searches. So I am going to share my screen and open the Medicare website, and we will get started. So the first thing, if you're going to do a plan search, is to know to just type into the address window at the very top of your screen, Medicare.gov. You want to go straight to Medicare.gov. You don't, whatever you do, you don't want to Google Medicare because that's going to expose you to a lot of copycat sites. So you want to go straight to Medicare.gov. You know you're in the right place when you see the American flag that says an official website of the United States government. So it's going to look like this. The landing page is going to show you a happy, healthy 65 plus person. And up in the top left-hand corner, you're going to see the open enrollment find plans. That's what you're going to click on to look for the plans that are going to be available in 2024. So you click on that and it goes over here. You can create an account on Medicare.gov and log in. If you do that, it can be a big time saver because all of your drugs will already be entered. It's just a matter of reviewing them and making any changes. But you don't have to, right? Where you can very easily continue without logging in, and that's what we're going to do today. We're going to be looking at plans for 2024, and the only personal information that you have to put in is your zip code because plans are all based on networks, and those are geographical. So I am just going to do 88415 for fun. And then the next thing that you do is you select what kind of plans you want to look at. And this tutorial is going to be on how to search Medicare Advantage or Part C plans. So there we go. We click on that and we go to find plans. The next thing it asks is if you get any assistance, because there are different programs available for people who have Medicare savings programs, or maybe they get extra help with their prescription drug costs from Social Security. For our purposes today, I'm going to put that we don't get help from any of those programs, but if you do, you would click the appropriate one and hit next. Unless you don't take any medications at all, you should always click yes, because for most people, the copays for their prescription medication is going to be their biggest medical cost each month. And we want to make sure whatever plan you look at covers your medication well. All your drugs are on the formulary and you get a good copay with that plan. So we are going to click yes and next. And then you're going to enter your medications. It is very important that you actually enter the exact medication. If you work with one of our SHIP counselors to do this, we are often going to ask you to go get your pill bottle and look on it, because as you can see from the example that I just started typing in here, you start typing the drug name and then it pops up a whole bunch of different options and you click on the correct one. So you can see metformin is not metformin. There are a bunch of different combinations: glipizide, glyburide, algoliptin, and metformin with pioglitazide, right? I can't even say that. And then I think the basic metformin is metformin hydrochloride. So for our example today, I'm going to choose that one. When you click on add drug, the next thing it does is ask you to choose the dosage. This again is really important to be accurate with, because this has multiple forms that your medication can take. There's a solution, a tablet, and then various amounts of extended release 24-hour tablets. So I'm going to stick with sort of the default just for our example purposes, but you'll want to make sure that this matches, and you can change this. You can change the quantity. Let's just change it to 60, just to show you how you do that. We're going to add it to the drug list. I'm going to add another drug. I'm just going to choose a really common blood pressure medication. Add that for our example purposes. And again, I am going to, for this example, just keep the default dosage and quantity. Add that to the drug list. And then we'll just pick another one. A very common cholesterol medication is atorvastatin. We'll add that one, add it to the drug list. Okay, and you just keep going until you've added all your medications. We're going to say that that's all this person in our example takes. And the next thing that we have to fill out is what pharmacies. Now, you can choose up to 5 pharmacies. I am going to, oops, I picked an example where, because this is a very rural area, I'm going to expand the distance out to the maximum, which is 25 miles, which probably isn't actually going to get us much. So if you find, let's say, so 88415 is Union and Harding counties, and there's not a whole lot of resources out there. So you definitely want to consider mail order, and let's do city drug as well. So I'm going to click those two, and then I'm trying to remember the zip code for Raton, because I think a lot of people in that area go to either Raton or 87740. A lot of people go to either Raton or Las Vegas. So I'm going to add a few more just in case. Let's say you go to the Mesa Pharmacy or Walmart, or maybe when you go in to get your groceries, you pick them up at Safeway. So now if you look down here at the bottom, there are 1, 2, 3, 4, 5 pharmacies listed. When you choose pharmacies, you're not saying that's where you're going to get your drugs. This just gives you the opportunity to look at cost differences in the various plans based on which pharmacies are in or out of network. And it's a very good thing to make sure you've filled all those slots. Okay. So now we're ready to look at some Medicare Advantage plans that are available in Union County. So the first thing that I like to do, we can see that there are 5 Medicare Advantage plans available in this area. They're sorted by the lowest drug and premium cost right here. So the first thing that I always do is I want to make sure whatever plans I'm looking at include drug coverage. So I go to drug coverage and I click include and apply that. So that now our options have gone down to 3. 2 of the Medicare Advantage plans did not include drug coverage. So now the next thing that most people I talk to, they really are interested in Advantage plans because they want vision, dental, and hearing coverage. So I'm going to go over here to plan benefits, and I'm going to select those because I only want to look at plans that offer that. So I know that's important to the Medicare beneficiary. You can also look at special needs plans, right? You can select for that. You can sort by star ratings, and you can sort by the insurance carrier, right? In this case, only Presbyterian and United Healthcare offer plans in this area. I'm not going to sort by that. The other thing that you can do is Well, all the plans in this area are PPOs, but you can also sort by whether it's a preferred provider organization or an HMO, a health maintenance organization. So these are all good things that you can do to sort through the plans before you get started. So now that we've applied all of our filters and narrowed down, we've only got 3 plans to look at here. We are going to take a look at the first plan. Remember, they're sorted by the lowest drug and premium cost. This is an AARP United Healthcare Medicare Advantage PPO. It has a 0 monthly premium. If you enrolled in this plan with the medications we put in, the lisinopril, atorvastatin, and metformin, you would have a 0 cost for your medications. That's why we put those in there. It says here that they have vision, dental, and hearing. Primary doctor has a 0 copay. A specialist has a $40 copay. I'm interested. I'd like to learn more about this plan. Never, ever make a selection, a final decision about a plan from what's on this first page. You always need to open up the plan details. It's this blue button right here. So now we're going to look at the plan details. This is where the rubber meets the road when it comes to these Medicare Advantage plans. The first thing is the plan ID, the official number that you would use to enroll in the plan, is right up here at the top. You've got a link to the website, and you've got a phone number to call so that you can get more information. If you're not already an AARP United Healthcare plan member, you call the non-member number. If you have a different United Healthcare plan, you would call the member number. We can see right here that this plan covers all 3 of the medications. All 3 of the medications are on the formulary. That's good. And now we can go through and we can look at all the plan details. I'm going to go over this pretty quick because there's only certain features that I really want to show you. Anybody can scroll through this. One thing that I do want you to know is that anytime there's an underline or a link, you can click on that and it will tell you, it'll give you a little explanation of whatever that topic is. So if you click on the link there for maximum you pay for health services, it drops down a little explanation that says once you spend this amount for covered services in a year, your plan pays 100% for your care. And you can see that the PPOs are all like this. If you get all your care in network, the out-of-pocket maximum for this plan is $4,300. If you go and get some of your care out of network, the plan still pays part of your costs, but your out-of-pocket maximum goes up to $9,550. So you can always click on those little explanations. Same thing. Limits apply. They don't really tell you too much, right? But you can click on it and it'll tell you what the limits are. In this case, for a specialist visit, there is advanced plan approval required. And the same thing, we can go through all of this for the diagnostic tests and procedures, which have a $50 copay in network, or you pay 40% if you go out of network. Lab services, which have a 0 copay in or out of network, right? You can go through and you can see what all of the costs are going to be if you join this plan. The next thing that I really want to point out to you that you may not know, this is why you're watching the tutorial, is that anytime you see one of these blue bars with a plus, you want to click on it because it's going to show you more information. In this case, it drops down how this plan covers mental health services like outpatient group therapy with or without a psychiatrist, the opioid treatment program, durable medical equipment, prosthetics, dialysis, diabetic supplies. It's really important information that you need to know before you select a plan. And if you don't know to click on the plus on this blue bar, you're not going to see it. So definitely, anytime you see a plus or one of these dark blue bars, click on it and it's going to show you more information. The next thing in the plan details is the drug coverage. You can click to see if there's help to lower the cost for the drugs that you take. In this case, the drugs are not going to cost you anything, so we're not going to do that. But all these explanations are here. Here's another one where the pharmacies, how do pharmacy networks affect what I pay? If you click on that, this pops up over here and gives you that explanation about preferred in-network, and out-of-network pharmacies. So that's very important information to understand. Okay, so in this case, all of the pharmacies are in-network and mail order is preferred. So if we scroll down, we can see the estimated copay that you would have when you picked up your medication for each of these drugs at each of the pharmacies. And these are very common drugs. They're covered very well by this plan, so you're not going to have any copay no matter where you pick up your medications. Depending on what medications you take, you may have to worry about the coverage gap. Here, if you click on this, it will explain what that is. In this case, no matter which pharmacy you go to, you're not going to enter the coverage gap with this plan. The next thing that we see in this drug section of the plan details is an estimated cost, a copay for your medications month by month. In this case, it's all zero, so that's good. We don't have to spend a whole lot of time looking at that. But if it wasn't, we could look again. There's a plus here in this section on estimated drug costs during coverage phases. We can expand this out, and it tells us exactly what to expect at each phase of coverage. So for the atorvastatin, the retail cost is $4.77. This plan doesn't have a deductible for drugs, so the cost is going to be the same, right? You're not going to enter the coverage gap, but if you did enter the coverage gap, it would tell you what you could expect in terms of costs, either both while you're in the coverage gap and after you exit it. So this is a great thing to look at and really understand where your costs are coming from during the different phases. And you can do that for each of the pharmacies that you might consider picking your drugs up at. Okay, if you want to know about tiers and limits, we click on the more drug coverage, and it gives you your drug cost by tier. Lots of more information here. How this plan would cover Part B drugs like chemotherapy, and insulin that's delivered via a pump, right? Those are all Part B drugs. They're here. So you can get really a lot of information before you decide if a plan is going to work for you by going through the plan details thoroughly in the Medicare Plan Finder. All right, now we're going to go down and we're going to look at the extra benefits. Here's where we see how the plan really covers the dental, vision, and hearing. Remember, on that first sheet we saw, there were nice green check marks next to each. But you can't assume that means that things are fully covered, because that doesn't always. So in this case, with the hearing exam, if you go in network, you have this plan covers a hearing exam with a zero copay. Out of network, if you go to an out of network audiologist, you're going to pay a $70 copay. They don't cover a fitting or evaluation. And then your hearing aids, if you're in network, are going to cost you between, in or out of network, are going to cost you between $100 and $1,249, right? So they're still not cheap, but there is some coverage there. This plan covers preventive dental, which is your oral exam, cleaning, fluoride treatments, and x-rays. And this is kind of nice, either in or out of network, there's a zero copay. It also covers comprehensive dental. So if you have, if you're exam shows that you have some issues that need to be dealt with, this plan will cover it. If you go in network, you have a zero copay. If you go to an out-of-network dental provider, you may have to cover up to half out of pocket. And here with the limit supply, there's both advanced plan approval required, and there may be limits on how much the plan will spend on your dental care per year. And here in the vision policy, routine eye exams are covered, contact lenses and eyeglasses, frames and lenses, but they won't just replace your frames. If your glasses break but your lenses are fine, you're going to have to pay for those new frames out of pocket. And the same with the lenses. If you need new lenses, your frames are fine, they're not going to pay for lenses only. And they don't cover any upgrades like invisible multifocal lenses or special coatings. All right, and so the last expandable here is the extra benefits. We're going to click on that. This is where you see if other things are covered, like chiropractic, acupuncture, alternative therapies. One thing that a lot of people are excited about is fitness benefit. This plan has some coverage. Also, the over-the-counter drug benefit. This is where you see if there's coverage for that. This plan also covers home and bathroom safety devices. So if you need grab bars or something like that, you may be able to get some assistance from your plan. Also, meals for short duration. If you have a health event and you need Meals on Wheels while you're recovering, you may be able to get the plan to help. So you can get really a lot of information about what the plan does before you make a choice. By knowing really how to go through the plan details thoroughly. I'm going to click over here on overview, which will take me back to the top of this plan details section. And I'm going to scroll up a little bit more and click on back to search results. And that takes me back. And we're going to briefly go through, let's see, here's another, you can see AARP United Healthcare offers more than one plan. So here's one plan. This has a 0 monthly premium. The next plan is a different PPO that's offered by the same company, but it's not going to have the same costs and benefits. This one has a $24 monthly premium, and your drugs are going to cost you, they estimate, $288 a year. So the first one looks better already. I'm not sure I really want to even bother looking through the plan details of this one. So let's take a look at the third plan here. It's a Presbyterian. It costs $164 per month. It estimates that your drugs with this plan would cost $2,290 for the year. Let's take a quick peek just so you can see the differences, right? You would think that if you're paying more, you're going to get a better plan, but that really doesn't seem to be the case in this situation. This one says it covers all three of the drugs, that they're all on the formulary. So the first thing that I want to do is see why that cost difference is so much. So I'm going to click directly on the drug coverage here, and it's going to take me to that section of the plan details. So I can see again that just like with the first plan we looked at, all of the pharmacies are in network and mail order is preferred, but they don't have zero copays, right? This plan has all the drugs on the formulary, but it doesn't cover them the same way as the first plan that we reviewed. So let's go down and take a look. Why? I wonder why it's so much. So this is the estimated cost for all 12 months. So I want to look at it by month. So it looks like you're going to be paying between $17 every 3 months if you go with mail order, up to $34 if you pick up your drugs at Walmart. So I wonder why it costs so much. I'm going to scroll down here because if you remember, we can see exactly what things cost by expanding, clicking on the plus here on the pharmacy. So with this plan, the Presbyterian plan, the atorvastatin has a retail cost of $11.70. The cost to you before the deductible is $11.70. After the deductible, it goes down to $4. If you enter the coverage gap, it goes down to $2.92. And after the coverage gap, then your copay would go down to $0. And you can see exactly what things are going to cost. So I'm going to go back up here. You won't ever meet your deductible, so you'll be paying. Your costs reflect the before you meet your deductible copay for the entire year because you're not going to meet the deductible in 2024. So that explains why those costs are so high. Now I'm going to just look and see how this plan covers hearing, dental, and vision. I can see that it does cover the hearing exam, the fitting and evaluation, one cost for in-network, a different copay for out-of-network, and then it looks like the hearing aids are potentially the range is different. It's $700 to $1,000 essentially for hearing aids. It covers preventive dental. You've got a $0 copay for preventive dental, whether you go to an in or out of network dentist. But when it comes to comprehensive dental, there's no coverage. So if you go to the dentist and you get your teeth cleaned and the x-rays show that you have a cavity, this plan doesn't cover getting your cavity filled. And it covers a routine eye exam, but it doesn't cover contact lenses or frames. And here's why. So if we go down here, they offer an optional package that includes comprehensive dental services for an additional $24 a month. So we find this on a lot of the Medicare Advantage plans. It'll say, yes, we have dental, vision, and hearing coverage. But what they mean is it's not necessarily included in the plan, but you have the option to add that on. So it's very, very important to really go through all the plan details. And then finally, we're just going to expand the extra benefits here. This one does include some chiropractic and acupuncture. Counseling services, it has a fitness benefit. It does not include an over-the-counter drug benefit. It says here that's not covered. So you can see that even though that this plan has a much higher monthly premium, so this plan is gonna cost you $164 a month in addition to your $174.70 Medicare Part B premium. It doesn't necessarily provide more benefits. So we're going to go back to the search results. And that's just a quick overview of some of the information that you can find and some of the thoughts that you might want to consider as you go through your options for Medicare Advantage plans. If you want further assistance, if you go in here and you start poking around and you're like, you know what, I really do want to talk to one of the SHIP counselors, you can reach us at 1-800-432-2080. We will be doing phone appointments all the way through December 7th. And we also have a series of in-person counseling events throughout the state. We have over 100 counseling sessions at various locations throughout the state. You can call 1-800-432-2080 to see where the closest in-person counseling event is to you. We're here to help. So if you can figure this out on your own, if you can get in there and really dig into the details, and that'll help you make the best decision for you, more power to you. If you decide you do want some help, we're here for you, 1-800-432-2080. Thank you.